Welcome to Clinical Conversations. On today's Smart Chiropractor Show, Clinical Conversations has been a segment we've used to highlight Access 2021. That was Smart Chiropractor's online clinically focused event. Details for Access 2022 are coming soon. But 2021, we had a variety of really awesome guests putting out information that was supremely powerful, and towards, if not at the top of that list, was Dr. John Rosa. Dr. Rosa is a fantastic chiropractor. He also has acted as a direct liaison to the White House amongst a variety of different administrations regarding the opioid crisis, opioid epidemic. He taught on that exact topic for Access 2021. We're going to visit a little sneak preview here, about 10 minutes of his talk, where he is describing where did the opioid crisis come from. If there's anybody in our profession that has the knowledge to speak on this topic at the highest level possible, that undoubtedly is Dr. John Rosa. So if this is a topic that interests you, and it should because it is impacting people in your community day in and day out, stay tuned over the next 10 minutes. Get those pens and paper out because Dr. John Rosa is about to share some very powerful information with everybody watching the show today.
Where did the crisis come from? Let's move into some of the things that brought the over-prescribing things to bear. So we had an origin of an epidemic, a heightened intent to aggressively treat pain. So these medications are being pumped out. The pharmaceutical companies are scratching their head and saying, yeah, we're making this and it's pretty incredible. And people in a hospital setting with crush injuries and major surgery or passing a kidney stone, and it's incredible how pain is controlled under those circumstances. Why aren't we treating anybody and everybody in pain? And they went after that market, produced fraudulent information that they knew was borderline at nothing, and then started paying the physicians that were participating in this research to make speeches and lectures across medical schools and institutions, including and through the government. The first study was done with 36 people in a hospital setting. They were given medication and then let go after a procedure and said there was zero chance of addiction. Well, that doesn't even make any sense. I mean, how do you even use that as your ground, the leveling playing field to say that that's going to be the case for anybody taking this going home for a toothache? Then there was aggressive advertising. So the pharmaceutical companies went in bananas and started developing programs for reps to go to doctors and say, if you're not treating pain aggressively, you're a bad doctor. And it started with foot soldiers, but then went into paper, television, radio. And then, of course, that whole government and corporate corruption as an overlap is there. So we also saw what was said, the fifth vital sign. That pisses me off. It should you, because we know what vital signs are. They're measurable things. You don't take a temperature by guessing. You don't take a respiratory rate by guessing. But pain is completely subjective. You're totally leaning on what they're going to say to you. But that literally went in as a vital sign into the hospital systems, into the VA, into medical doctor's office. And they were prescribing, if that little smiley face to frowning face, the 5 things, if you were in the middle or higher, you were prescribed an opioid because you had to treat people in pain. And then the government gave bonuses to hospitals. Now, I know these hospital boardrooms because I've actually been in a few. Now, I know that all they're concerned about is how much money they made versus how much they spent. That's all they're concerned about. They have to make sure that the money keeps flowing through the system or the hospital doesn't exist. So the government, through Medicare, Medicaid systems for state and federal, they would pay bonuses based on how well you controlled pain. Regardless, if somebody went in with a skin rash and was given a topical cortisone cream and they were asked about their pain and they're like, well, yeah, my back bothers me. I work construction. They were given an opioid, and they were given it at alarming rates because the system, when it controlled pain and improved it actually received bonuses through the government. The writing is on the wall. The announcements of death rates going through the roof. We're talking 13, 14, 15, 16. It was obvious. Things were being written up. It was on television. All while that's happening, they're getting laws passed through the money given to congressmen and senators for re-election, and the attorneys who were making these laws and decisions that get pushed up to get a pen to ink it. 56 lawyers from the DEA and Department of Justice were hired by pharma. 56, and 2 of those were at the highest level, 2 deputy attorney generals. Attorney generals are our highest law enforcer in the land. 2 of the deputy attorney generals came out and were hired through pharma. Now, when decisions get made, and if you don't think the deputy attorney general still has a bat phone that could connect to the attorney general or their people and saying, hey, you know, we need to calm this down. Don't go after these guys. This is a source of business. We're treating pain. It's pretty obvious how that revolving door in politics, you're an attorney working for the Department of Justice. What you make is tenfold when you're out and promise that job when you're working for Purdue. And this is just a massive scale, and it shows at the end pharmaceutical donations to campaigns. Obviously, combining all half of that chart to the right doesn't even equate to combined efforts of the largest, which is the pharma company. It's a controlling factor. So how opioid dependence are progressing over time? An interesting fact, you take it, you're happy when you're first taking it, it's pain relieving, and it actually gives you that sense of like I said earlier, that I don't care. But very quickly, it could be after a few days or a few weeks, and in some cases a few months, the medications, your brain starts to dampen the effect of it because it doesn't like to be overstimulated in that way. So you get what's called tolerance. And your brain is trying to protect you by saying, I don't know what the heck's coming into the system. And initially it was the opposite, telling you, you better go find that. It makes you feel good. But then after a while, the brain shifts and says, well, wait a minute. I don't know about where we're headed with this. I'm going to dampen the effect of the receptors for an opioid, because I'm not really liking what's happening to the frontal cortex, which is actually getting smaller. So we go into protective mode. Then you're unhappy for obvious reasons. And here's the kicker. There's an increased sensitivity to pain that occurs. So one of the major side effects to opioid medication is hyperalgesia. What the hell is that? You're taking a medication for pain, and one of the major side effects is that you actually have increased sensitivity to pain. So where do you think the prescribing habits go? The milligram level has to go up, and the frequency of the pills being taken has to be decreased. So you're taking stronger medications more frequently through the day, and you can imagine where that cascade of events heads. What happens? They can't get the prescription anymore because they've reached the max. All the noise and confusion, and doctors are concerned, I'm going to get sued too. They start telling their patients they can't prescribe it anymore. This is where the whole thing blows up in everybody's face, because now they have to go get those same pills on the street. There is no way their body is going to survive a day without having the medication, and they're cut off. Those pills are $60, $50, $60, $100 a pill, depending on the milligram strength and who you're getting it from. And some of these people habits are at 30, 60, as high as 100 pills a day. You can imagine, after selling them their belongings, the loved ones' belongings, after stealing them or selling them their bodies and themselves, eventually can't even keep up with that. So that $5 little bag of heroin that gets waved in front of their face, that they said they would never be that person to do that, that's where it starts. Fentanyl has popped into the system in all illicit drugs everywhere, including marijuana. I mean, a fatal dose, if you look at this, and carfentanil was another thing that came into the picture, but fentanyl is really the problem. That little couple of grains of salt you see on that penny is a lethal dose. And there are kilos and kilos of this at a time being confiscated, and they're only a fraction of what's coming across our border. There is enough fentanyl right now in circulation that can kill the entire population of the United States 10 times. So you can imagine how lethal and insane this stuff is, and it's so much easier to get into the system, into our system, meaning societally. And here's the reason. You have a $5,000 for a kilo wholesale. It can turn into close to $5 million in profit. There's nothing on the planet, gold, platinum, oil, water, that has a margin change than that. So you can imagine the people that are pushing this, they're not just not going to leave that money on the side. It's going to come through. So we're seeing it powdered into everything. Before I go into what we could do about it, the crisis, the trouble with fentanyl, when I was at that fentanyl summit, the FBI and DEA were saying that every time there's a bust, they have to test every package. Some of those packages were 20, 30% fentanyl and others had none in it. So now you can imagine the little bit of those grains of salt that can kill somebody. People are dropping like flies because it's not something like it's made in a lab where you're counting out to the milligrams or micrograms of a product. It's just floating around there. So what are we going to do about this? We're going to have awareness. I'm going to try to get through this so that we keep into time. So once again, I want you to know that if you reach out to me, I would be more than happy to help, share, and go through any of the questions you may have. But awareness is huge. We're the beacons. We know we're professionals in marketing for obvious reasons, because we've had to sell our profession to others forever. So why aren't we out there blowing horns about why this problem and this crisis could have been avoided if there was just utilizing something like ourselves? Well, we can. So we need to, and we will. We've got to educate the public at every turn about the dangers of those prescriptions. Doctors have to be taught to utilize those alternatives, not just to say, I'm going to stop prescribing, but what can we use? Legislators obviously need to appropriate the amount of funds. We need to support those who are addicted and their loved ones. But here's a bunch of, these articles will show that there is plenty of reason to show awareness to physicians to make a change. This is from 2017 American College of Physicians for Low Back Pain. Spinal manipulation is effective and should be used for acute and subacute low back conditions prior to writing a prescription. Spinal manipulation, again, for chronic low back pain, should be utilized prior to prescription. Annals of 2020, once again, American College of Physicians and the Academy of Family Physicians for non-low back pain. Topical analgesics, of course, we use it. I'll describe the one that I use in a minute. Non-low back pain, acupressure improves physical function, electric nerve stimulation reduces pain. This is the American College of Physicians and Family Physicians stating for back pain and non-low back pain, pain in general, that the things we do in our office every day work. BMJ tosses in, this is now from 2019, their design was a retrospective study cohort now looking at a ton of information from 8 to 13. And what do they conclude? They're concluding what we knew all along, that initial visits to chiropractic and physical therapy is associated with substantially decrease in early and long-term use of opioids. Voila. And here we have a study from Yale School of Medicine in 2019. And they also, their objective was to determine an association between chiropractic use and opioid receipt. What do they find? Conclusion, the review demonstrates an inverse association between chiropractic use and opioid receipt, of course. This is a study that I actually just got published in Journal of Manipulative JAMA. So it's from April 2021. This 30% decrease, what I did here was I infused myself into a medical office, and I had a room and I did my managing of all my clinics there, but I physically was present. And instead of writing a script, they walked every single pain patient into my room. They were seeing about 100 patients a day. I got about 10 to 15 of those people and treated about 8 of those. And we went from 30 to 70% decrease in opioid script writing. When I say 70% is on the higher spectrum, the stronger strength opioid writing versus even just the smallest, but the average being 30, and there's plenty of studies that range from 30 to 50% decrease when it's utilized. But this was an interesting study because it showed that by us being infused into the medical system in itself, and I had that meeting and said, well, you got to tell me why is it so much difference that you're not writing? And the answer was, well, you're here. So it's really as simple as being available, because they don't want to go through the pain of having to talk to them about where they're going to go and try to make a referral and get them out. The other part of the problem is that he used to say, I would send them out and they would come back because what I sent them to do to get treatment, whether it was physical therapy, chiropractic, acupuncture, it wasn't covered in their insurance. So they came back and I gave them the meds anyway. So there's another part of our problem where we've got to make sure that we are covered. And I know there's something going through with the Medicare package, which could make a big difference. So you should really pay attention to that as well and participate.
Powerful, powerful information there from Dr. John Rosa. That was from Access 2021, as we said at the top. So this is a topic that is affecting everybody in every town. I don't care where you live, where you're watching from, where you're tuning in from. This is a real issue. It is very clear to me. I'll refrain from getting too hot about this, but do no harm. You'd think that was a Hippocratic oath and that people would abide by it. It does not happen. It has not happened for decades, and it probably, quite frankly, won't happen for years to come. The good news there, if there is any, is that that is an opportunity for you to get out there, to connect with people where they're at, to help people better understand who you are and what you do, so they don't go down what I call the journey of professional indifference, which quite often happens in the medical model, specifically with spine-related complaints. Big topic. This is, we could do hundreds of hours on this. Thank you, John, for coming on, teaching. There's just fact upon fact upon fact, one-liner after one-liner, but this is important data to know. It's also important data, I will say, to close up on my accord, to not become desensitized to. I think chiropractors out there, you hear it so often, it's like, yeah, whatever. Or you hear about, well, 90% of people have spine and musculoskeletal issues. Yeah, whatever. It's not that. This is a very, very real thing. And whether your practice is, taken off like crazy, or if you're struggling, there is so much opportunity out there. It doesn't make sense because it's impossible to actually comprehend. It's a communication issue if you find that you are not able to really build and grow. There is no shortage of need. Pain is one of the primary motivators in people's lives, and pleasure. So whether you are a performance doc or a pain doc, there is a plethora of opportunity. It's about systems, processes, automation, communicating your message at a level that people can understand. I could go on and on about that, but Jason, I'll kick it over to you.
I could go on and on about it as well. We did a segment in the mindset segment this week talking about how to stay sane in an insane world. This is the insane world we're talking about. It just is completely non-logical. It is beyond anybody's comprehension. It's just unfathomable how so many people are being prescribed drugs that in this day and age we know are dangerous, we know are addictive, we know don't correct the cause of the problem. And yet it's everywhere, literally everywhere. And it isn't just limited to people that don't have insurance. I have met people who have had family members who have become addicted themselves, who have had issues themselves. It is at every socioeconomic level, from the bottom to the top. No one is immune to this issue. And it's just a tragedy. So if you haven't watched my video on how to stay sane in an insane world, the punchline is focus on the things you can do something about. This is a topic we actually can do something about. So helping people understand the impact of correcting the cause and actually being available to do so is really the difference that makes the difference. Complaining about it doesn't help. The medical establishment seems to just throw wood on the fire to keep it burning. It just doesn't make any logical sense whatsoever. But if you know, you know. And if you know, it's time to do something. And kudos to John Rosa for, busy guy, very busy guy, multiple clinics, as you said, worked as a consultant to the White House, doesn't need to be sitting in a room in a medical office to conduct research in order to establish something new that hopefully makes a dent in the universe. And you did, John. So bravo to you for doing something about it. Bravo to you for bringing it all to us. And thank you for having that kind of passion and fortitude and intellect to make something happen. So thank you, John.
Indeed. And if you are listening and watching and you haven't seen all of what we presented at Access 2021, head over to YouTube, subscribe. We got a playlist with all of these bits and pieces, and keep your eyes and ears peeled for what we got going on with Access 2022, which will be coming up later this year. Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.